JJ teaches you life.
Yes.
Oh, I never wanted to become a physician.
Oh, that's great. I didn't know this.
I never studied medicine. I wanted to do surgery.
But I'm so lucky you didn't, otherwise.
I would have been out of this hospital.
No. Hi, good afternoon, everyone. This is the third episode on Consultants on Couch. I must say, I highly appreciate the kind of love and responses that I'm getting for this. If you like this wonderful third episode that we are going to have, please like, subscribe, and forward this. Today's episode, I think, is one of the game changers. We've got a very young, dynamic, whom we all call celebrity doctor, Dr. Abhishek Bhargav, and I would like to welcome him for this podcast. Hi Abhishek, welcome.
Thank you, sir.
And celebrity is the right word. I think you look after a lot of celebrities, and you've been very famous in the area.
Thank you for.
I'll just introduce you to the audience today. And Abhishek is a MD physician. His primary interest is in general medicine, but he's an expert in diabetes, endocrinology, a lot of cardiac cases, and these are his go-to places. He has been our family doctor. All of us in my family call him the crisis man. And he keeps on getting phone calls from anything from headaches to anything, absolutely. He can be your general physician. But his expertise, as I said, are in endocrinology, Abhishek, and diabetes, cardiology,
and critical care.
And critical care. Now, that's where his real training was, critical care. So briefly, Abhishek, if you could tell the viewers of your medical education. I believe you are from JJ and then Jagjeevan Ram, and then you spent quite a few years at Bombay Hospital.
So basically, I did my MBBS from Grand Medical. That's JJ.
Notorious place.
Very notorious.
All my friends are from. I'm the JJ kind,
really?
But I've been from Nayar.
So you see, in JJ we don't attend any lectures.
Yes, absolutely.
I have never attended a lecture.
Wow.
First day, second day when we were getting ragged, that's when we entered, and after that we never entered anat lecture theatres or a physio lecture theatres. For that matter, I've never attended a lecture.
But I'll be honest, you look more the studious medical guy. I know orthopedics from JJ who just fit into that bracket.
So in JJ, if you had to learn medicine or you wanted to pass your MBBS, attending lectures was not the way to do it.
You had to do a lot of self-study.
So you had to do a lot of self-study. For the first 3 months you couldn't, and the only place to do self-study in JJ is the library. It's very famous.
Beautiful.
Very famous. And you don't get entry, at least during our times, for the first 3 months.
Oh.
So you're basically loitering on the streets. Trying to figure out.
We used to go to JJ because of friends in our time. And it had this beautiful campus and wonderful canteen. And the difference for the viewers, just tell them, what is the difference between JJ is Grand Medical College and it has that beautiful cricket ground on Marine Lines.
We have a Grand Medical Gymkhana. We had, if you come to JJ, which is 43 acres, multiple buildings, but the boys' common room, what we call as BCR, used to be our den.
Wow.
So that is where we used to spend a lot of time, just chit-chatting.
Okay.
Just doing any kind of hooliganism, which doesn't show on the face right now. And our central canteen, which is known as CC.
That was
very
nice.
Famous.
A big, huge place.
Yeah, very, very famous. So, as soon as you arrive, you enter CC.
That's where you get introduced.
And when you leave from the CC.
Wow. But what is the difference between, say, KEM, as I had a chat with Samir, and KEM was the premium institute, probably still is. Grand Medical College, how is it different from Nayar, Sai? And I believe that's a central government college, is it? And how?
JJ teaches you life.
Yes, very true.
You left all alone there. It's like throwing a baby into a swimming pool and asking him to swim. JJ does that.
Great. And some of the best doctors are from JJ. I mean, Woodwadia and
You have to learn to swim there.
but one of the most
That's
pioneers.
awesome. Awesome. JJ taught us life.
In JJ, what inspired your JJ education? Who inspired you from JJ to become a physician?
Oh, I never wanted to become a physician.
Oh, that's great. I didn't know this.
I never studied medicine. I wanted to do surgery.
Wow. But I'm so lucky that you didn't, otherwise.
I would have been out of this hospital.
No.
So, you see, during surgery, I never read medicine.
Oh.
Yes, I was good at studies and stuff. I was in the merit batch and stuff like that. But medicine, I knew nothing.
Okay.
I didn't study medicine. I wanted to do surgery. I had read Love and Bailey multiple times. And I was crazy behind surgery.
Oh, that's so, because now when you ask me to operate, I think most physicians that would refer surgery, their knowledge of surgery is a little bit, not as good as, and when I get patients from you, I think your surgical knowledge is still very rounded and you know a lot more about surgery than, a normal physician does.
Thank you for that. I wouldn't pride myself now.
No, but still, I think, the basics are there.
So, wanted to do surgery, and then in JJ, what you have to do is spend time in the wards.
Yeah.
No one teaches you, and since the beginning, you have also not gone to learn from anyone. So, it's hand in glove. Neither someone is teaching you, nor you're going for the teaching. So you spend a lot of time in the wards with the patients. Throughout the day you're there. I mean, say 9 o'clock if you're coming down to the hospital.
For long hours in the...
So throughout the day you're there only.
Okay.
So you keep spending time and then,
knowing your patients,
knowing the patients, reading about it, then visiting the OT, just hanging in there. You may not do anything there, but just hanging and
presence.
standing there.
Just absorb knowledge.
Yeah. So that's what we used to do, and then we used to start presenting cases. We presented a lot of cases. So it was all about surgery. After the third MBBS, when we got our marks and all, I barely passed medicine.
Oh.
I never read it. PJ Mehta I read.
Oh,
I never even touched Harrison, which is gospel for medicine. Never touched Harrison. I used to hate it. I read PJ Mehta.
Great.
Just managed to scrape through MBBS in terms of medicine. And then I think there was a year that we had to wait because they had announced entrances for PG for my batch. So direct admissions based on our marks was not happening.
Oh.
So, I mean, our internship got over sometime in February, March of 2002, and our entrance was supposed to be in January 2003. Like everyone, sat home.
You have to read.
Start reading. 3 months tried it, then I realized it's not my cup of tea to sit and read. Nahi hoga. And somehow the other landed up at Bombay Hospital. Wanted a post where you don't have to stay back.
As non-resident.
Non-residential. Non-residential posts in Bombay Hospital were only in ICUs.
Because they 8-hour shifts.
Because it was a shift duty. They appointed me. Okay, you come, you learn first. And I was a fresher. I mean, just an MBBS pass out, knew nothing. Knew nothing at all. Medicine to zero tha. So, joined. First month, really didn't figure out what is happening. I was in the third floor ICCU at Bombay Hospital, which was the de facto casualty also of the Bombay Hospital.
So everybody would come there.
So any emergency from the casualty
would come
to I mean, Bombay Hospital.
Seen by doctors of the ICU.
Was supposed to come to the ICCU. So it was also the casualty, plus it had a lot of cardiac patients and multi-system patients.
Pressure.
So it had a huge turnover and a lot of pressure. It had, I think, 13 beds. And for the first month, tried figuring out what a ventilator is, what central line is, what arterial line is. All the typical procedures and all that you see in the ICU. Then I developed an interest.
Yes, absolutely.
I realized, this is what it is.
Yeah.
Patient is coming with hypoglycemia and you give an injection, is all right.
It's all fine.
Yeah, this is it.
It makes you feel like a doctor.
Yeah, it makes you feel great, you achieve something. Someone with SVT barely able to breathe and you give an injection, it's all right.
All right. Nice.
Someone comes with VTAC, you shock and all right.
Wonderful.
So it was very, very dynamic. I said, ye karna hai. This is what has to be done. So started reading about critical care.
Oh, so critical care was what got you
Yes.
into...
So started reading critical care, bought a Washington manual, read that entire manual. And what I would do is, I would do extra duties there. Even if they were unpaid. Even if I was an extra doctor there.
Oh, wow.
So
that developed a very keen interest in medicine.
in 3 months, I was pretty much a pro. Read ECGs, learned ECGs.
But who sort of inspired you in Bombay Hospital? There must have been good teachers, your seniors and your...
So Jahangir Surabji, who's actually my
absolutely.
mentor and teacher. So he was there. Praveen Amin was there. Bagle was there. Dr. Bagle. As far as medicine, Dr. Ramurthy was there.
God.
A teacher of mine. So there was a lot of things to learn
So
from them.
now when you look back at your inspiration of doing medicine came from Bombay Hospital because they were...
Absolutely.
And there were these stalwarts there. I mean, Ramurthy, though, I think nobody in Bombay can sort of dispute that
no one can.
he is somebody who's inspired a lot of people. Even surgeons have got inspired by him, so he's like... But how long was Ramurthy there before he passed away?
So Ramurthy retired.
He was very senior, by
so
that time.
I think he was there. He was there. I had finished my residency also then.
Oh, you...
So then when I went back to Bombay Hospital, he was still there. I was here. I've called him here also.
Yes, I know he's come and visited once.
To see one of our patients in the ICU.
Okay.
I've been to his residence also. I think he passed on about 8-10 years back now. With multiple myeloma in Leelavati.
So was he a big inspiration in terms
very big,
of...
very big. But the actual goal driver, I would say, was Dr. Jahangir Surabji.
Oh.
He was the actual goal driver.
And he was sort of the intensivist in
No,
charge?
he
Or
was
just
a physician.
Okay.
So I'll come to him how he inspired. So what happened is that I was actually a plain poster at that point of time, and then I decided no, medicine is what I have to do because I eventually have to do critical care.
Yes, okay.
Critical care is where my forte is.
Wow.
Baki sab is forget
Baki is writing
surgery.
medicines.
I can't prescribe anything there.
Yeah.
So forget surgery, medicine. So I was a plain poster, and Bombay Hospital was supposed to get a DNB seat. It was supposed to come under Dr. Banka in 2003. So 2003 August is when it was expected to come.
Banka had a DNB medicine under him, huh?
Yes, at Bombay Hospital.
Oh, wow.
So this was sometime in October, November. Dr. Kriplani, who was head of nephrology, again, very well known. His son and my son were in the same batch.
Achha.
I mean, not physically in the same class, but he had also passed out. He was also sailing in the same boat. So one day I was traveling to Bombay Hospital, and in the train I happened to meet Dr. Kriplani. And he said, Abhishek, what are you doing? Are you passing away time? You must go do something. Why don't you pursue DNB? And I said, sir, I'm hoping if I do fine Bombay Hospital, I'll get a seat. I said, but that will come later on. You go to this hospital known as Jagjeevan Ram Hospital.
Very closely associated next to Nayar it was, and we used to have a good time in Jagjeevan Ram. I had some friends working there.
I had never heard of it, even though it was not that far from JJ.
Attached to the railways.
Railways. So he said, you go there. They have a DNB exam.
Seat. Okay.
They have a medicine seat. You go and apply there. I said, okay, sir, I will go and apply. I went to Jagjeevan Ram. I was seeing the glamour of Bombay Hospital. Jagjeevan Ram was a 330-bedded hospital. Smaller hospital compared to Bombay Hospital. Didn't have a CT and MRI in the campus or a cath lab in the campus at that point of time. इधर से तो पढ़ के तो कुछ फायदा है नहीं, कुछ सीखने तो मिलेगा नहीं, आधी चीजें हैं नहीं, but whatever.
Got your DNB from that.
So applied there, gave the written exam, and my relatives were there. So I said, "Okay." Some Saturday was the exam. I said, "Okay, I'll go and give the exam, and then we'll go out and roam around." Gave the theory. They said after within an hour they let us know the result.
Oh,
So within an hour, I was in the short list. Said, surprise, chalo, theek hai, I'm in the short list. After the short list, there was a Viva. And Viva, essentially, when I went in, they asked me, what am I doing? And I told them I'm a trained poster at Bombay Hospital in the ICU. And they asked me only ICU related questions. Both was my bread and butter at that point of time. I kind of cracked it.
so your journey was basically JJ, Jagjeevan Ram, and then
Back to Bombay Hospital.
back to Bombay.
Yeah.
And critical care was what your
Interest was.
interest was. So from the critical care, how did you sort of progress on to general medicine?
Oh.
Why did the journey not end up with sort of being just related to critical? What inspired you to sort of get into normal medicine?
So that's interesting. So after I did my DNB medicine from Jagjeevan Ram and then came back to Bombay Hospital, I was, after my results and everything, I was appointed as the intensivist of one of the, I was heading one of the ICUs, which was the 14th floor, brand new ICU. I was the youngest of the lot doing it, and everything was fine. I had registered for EDIC. I was also enrolled into the ICCM program. So everything was on lines of critical care. In between, I had also gotten a fellowship at Singapore for respiratory and critical care medicine.
Okay.
And I had an offer from Canada also to pursue critical care and nephrology together.
Nice.
While I was working at Bombay Hospital, one of my friends told me, Abhishek, what are you doing? I said, no, I love critical care, I'm doing critical care. He asked me, what is it that you want? I said, no, I want patients. I want people to know me.
Absolutely.
I mean, I want the entire cloud that, you associate with
Being a doctor.
Being a doctor.
Successful
and,
doctor.
and so on and so forth with, how Surabji was, how Ramurthy was, and so on and so forth. Then he asked me, how many people outside this hospital would know the critical care specialist in this hospital? And that struck me. Because no one outside
Would know the critical care.
actually knew the critical care specialist who spent nights awake to treat the patient, and the credit is the treating physicians.
So you ventured out to private practice.
That struck me, and I said, no, if it's not your patient, then it is.
Anybody in your family, Abhishek, is a doctor? Any sort of father, mother?
No one. My distant aunt was a doctor.
Okay, distant aunt.
If that counts. She was a doctor in the army.
Okay. So what inspired? Did you always want to become a doctor, or what sort of led you to become?
So I was in grade 6 and we were playing football, my brother and I have a younger brother. So we were playing football and surprisingly the next day he couldn't move his legs.
Oh,
We didn't know what to do. We ran pillar to post to multiple doctors and then we were referred to an orthopedic at Bombay Hospital
okay.
that this gentleman would solve the issue. And we had an appointment for 12:30 in the afternoon. And we went there. We waited till 6:30. And we couldn't see the doctor.
Dr. Dolakia, who was a doctor?
I-
Very senior.
very
Bombay
senior.
Hospital is.
I wouldn't name.
Okay.
And we waited and waited. And I got really frustrated.
Okay.
And my poor brother was in pain.
Pain and stuff.
He was crying. And I told my mom, I'll grow up and I'll become a doctor.
Oh,
And I will
nice.
see to it that you don't ever have to wait for a doctor.
Wow, what an inspiring moment that was, huh?
That's the inspiring thing.
Then that's what made you study and work all these long
Absolutely.
hours, burning the candle.
Otherwise, मुझे तो chef बनना था.
But no, that's That's very. We must thank your brother for that now. All the treatment that you give of me and my family. So,
So that is how it is. I mean, that is what led into doing
so
medicine. Also.
with your education, now let's come to the COVID part. Because Abhishek has been with us for over 10, 12 years and been managing, he's virtually part of this hospital. And COVID was a very difficult time. Surgeons was okay. I mean, we still had to work and stuff. But I remember COVID times were one of the worst times for, there were good times, there were bad times, but COVID was very stressful. You all sort of, I remember seeing you in that PPE kit, eating in the car, and it was very brave of you all. What do you have to say about COVID times? Any sort of incidents or what led you? What was your mindset? What was your family worried about COVID? A lot of patients don't realize. I come across very frivolous comments in social circles. Oh, people made a lot of money in COVID. Doctors made a lot of money and stuff. But from your perspective, you let the viewers know what exactly ran through your.
It was the worst possible times. What money you made? I mean, it's not the question of any money that you made. Your life was a hell. It was absolute hell. I mean, we used to leave early in the morning wearing a PPE kit. I used to wear shorts inside and then the PPE kit, and with the whole kit and with the mask, which was a full shield mask, which is very different from your regular N95 mask because you were dealing with COVID patients directly. And be out, you had a shelf life of 6 to 8 hours because you can't go to the washroom.
Yes.
You can't pee, you can't eat, you can't remove the mask, you can't remove the PPE suit. Once it's removed, end of the story, you have to go back home. So 6-8 hours, and it was on summertime.
Absolutely.
You were sweating like a pig. Sweating like a pig.
What about the mental trauma that
It
sort
was
of
horrible.
I mean, treating patients, seeing patients die,
The suffering was horrible. I mean, I have never seen these many deaths that we've seen in COVID. And deaths were not just here. We used to do a lot of online consults also.
Exactly.
I had 1,000 active patients
During
at a point of time during our second wave, during the Delta wave. It was completely stressful. One was consulting till 2 o'clock, 3 o'clock in the night, and 6 o'clock again in the morning you started because you just can't complete.
Very stressful.
Very, very stressful.
Is this stressful for your family too?
Everyone. I was just in depression. I was just in depression. You're seeing someone from Bihar, you are consulting, and the family is crying कि please डॉक्टर साहब कुछ कर दो, बचा लो हमको, हम मर जाएंगे, उधर भी मरा है, उधर भी मरा है, इस पूरे कॉलोनी में सब मर गए. How do you deal with that?
So what are your sort of views on pandemics? Do you think so? I'll be honest with you. Now, when we were students, which is quite a while before you were, chikungunya, dengues, malarias, which form a big part of your practice now, were not, malaria was heard of, but dengue, chikungunya, COVID, what do you think is the reason for this sort of a dramatic change in our disease profile? In surgery, we have a change in disease profile, but what are these You're a big expert in infectious disease because you've done in Singapore and you talk a lot about infections. Just why has this happened? And what is sort of, how do we as a society tend to prevent these?
See, it is basically rapidly changing lifestyle and industrialization. Now these illnesses that you talked about, malaria, dengue,
Chikungunya, come on, this is a wave of chikungunya.
I'll come to that. It's all mosquito borne. Where are these mosquitoes breeding? They either breeding at construction sites or they're breeding at your homes in those flower pots.
Yeah.
So as your lifestyle has evolved and as construction has been happening all throughout, the mosquitoes have been breeding. Years back, it used to be when we were medical students. It used to be during the monsoons. It should be only malaria.
Yes,
Only malaria
was
and that also only Vivax malaria.
No, we've had a very bad malaria. You remember in the
Ah,
hospital? It
no,
was
no, no. I'm
terrible.
coming
All
to that.
hospitals.
I'm talking
had-
about medical school days in the 90s.
Yeah.
It used to be plain, simple Vivax malaria. No one would get admitted. Everyone would take
Yeah,
chloroquine.
chloroquine be fine.
Be fine. Someone who's had falciparum was something like a crisis scenario.
Yeah.
At that point of time, how can you get falciparum malaria? When we got into practice, I think in 2012-13, there was a huge malaria wave.
That's it.
It was the same Vivax, but it was so virulent.
Yeah.
So virulent, people were getting ARDSs, cardiomyopathy,
No
renal
beds, no
failures,
ventilators.
nothing. It was a very bad phase. I mean, Vivax had become absolutely virulent, and falciparum was like a falciparum hai, theek hai, bach jayega. Vivax, there was no guarantee. It was completely.
So what do you think is
mutation?
Environment, mutation.
These are all mutations happening. I mean, it's the survival of the fittest.
You would expect another sort of a pandemic sometime in future. Is that what would happen? Bill Gates has been harping about.
It's possible. It's
How
possible.
how do we prepare ourselves for that? As a doctor, as
You can't
patient?
prepare for anything.
Yeah, these
Because you don't
calamities.
know what is going to hit you. Okay, now this rainy season, we had a pandemic of chikungunya.
Terrible. Never heard of chikungunya before.
It was something that I'm telling you, even in medicine, I did not read much.
Yeah, no, there was these small snippets everywhere, you know.
Harrison barely has a small section on chikungunya. Chikungunya was purely of, academic illnesses, like you have multiple other illnesses.
Yeah, sleeping illness, tsetse fly, that we used to give for these extra marks in exam paper. So another pandemic, which a lot of people is not that acute, is obesity. You treat a lot of diabetics, obesity patients.
Obesity is one of the largest and the biggest non-infectious pandemic. It is real huge, and the main reason behind it is our lifestyle.
Absolutely.
Urbanization, from rural to urban, Western diets, fast foods, processed foods, sedentary lifestyle, long working hours,
OTT platforms.
OTT platforms. and you see, in today's time, everyone wants instant gratification.
Exactly. The discipline is on.
But no one wants.
Now we see a lot of youngsters, they are into a lot of gymming, a lot of youngsters. It's a mix. It's a mix.
What happens is that that also has an age. So late teens to your late 20s, you are into that gymming.
You want to be Instagram friendly and social media appearance wise.
As soon as you are in your 30s,
that's the time they lose it.
And you have your family, you have your job. You've slightly progressed in your job hierarchy.
Then you start eating.
Responsibilities come in. It all goes for a toss.
So you manage a lot of obesity and a lot of diabetes and stuff. What are your views on? Obesity is the thing.
Is the thing, and let me tell you.
Some advice to the viewers, just briefly. What is Ozempic? Would have you recommend people not, if they are they have an indication, that's fine. But there are a lot of patients who take it as a fad, weight loss. So just let us know what is what it means to medicine.
You see, Ozempic, which is semaglutide, it's a wonder drug.
Okay.
It is heart protective, kidney protective, helps reversing fatty liver, corrects blood sugar, reduces blood pressure.
Wow.
It's a powerful antioxidant.
Wow.
Reduces appetite. Brings about early satiety, so you don't eat much. And the biggest plus point is it causes weight loss. So it's a wonder drug. Now, because it's causing the weight loss. Now, because it's causing the weight loss, it's catching on to people's eyes.
Yes.
No one likes diet. No one likes lifestyle changes.
It's a quick fix.
It's a quick fix. As in
But
today's
it works
time,
as a quick fix.
it does work.
Okay.
Now, the issue is that A is the tolerability. it has to be under medical supervision. You can't just go to the chemist and
that's
I want an and start off, because it has to be gradually graded. You need
You
to be
still don't
assessed.
get injectable in
It's
India.
not licensed in India, but you have enough gray
Yeah.
market supply. So it is licensed in the US, the UK, Middle East, Australia, New Zealand, throughout the world, and I think in India it will be licensed in the second half next year.
But your take on is it's a safe drug.
It's a reasonably safe drug for the right kind of people.
Yes. But it should not be a fad.
No. It
should
cannot
not
be indiscriminately used. Now tomorrow you say, I'm 5 kilos
Oh,
overweight.
yeah, I just
I think you
oral
should.
works as well as
So
for weight loss.
Oral brings about somewhere around 5% of body weight loss. Okay. Injectable can bring about 10 to 15% of body weight
But
loss.
once you stop, you'll put on weight.
So these drugs do not bring about a permanent weight loss.
Yes, that's the message.
You achieve weight loss for a period of 6 months to a year.
Then get motivated to lose more
Once
weight.
you've achieved the weight loss and you decide to stop the medication, you will have to maintain it.
Yes.
The problem is that in the beginning, if you're given diet and exercise, which does not produce any result, you are less likely to follow it.
Yes.
Once you've achieved 15-20
Certain
kilos
amount,
of weight
then
loss,
it motivates you.
you're
and
lighter, you're motivated, and then you want to remain that way.
Yes, and you can exercise more probably once you're.
Yes. So then I think the motivation is there. Once the motivation is there, you're more likely to maintain. And there have been clinical trials over a period of 3 years. After stopping, patients have 90% have more or less maintained the weight.
Oh, not bad.
10% of course gained weight again, but 90% have. And in the next 5 years, we're talking only about right. There's which is better.
Yes, a lot of
In terms of weight loss, it brings about 15 to 20% of body weight loss. It's going as good as bariatric.
So I was just reading about there is a wonderful book called Lifespan
Okay.
by David Sinclair. They are not even thinking in terms of stopping aging, but now tomorrow the science is going to be about reversing aging,
Absolutely.
and it will be just a pill away.
It is quite possible.
It's going to be a pill away.
The next decade, the 30s and the early 40s, could be on aging reversal.
dementia, Alzheimer's, and stuff.
Pretty much possible.
So your percentage of lifestyle disease is very high, isn't
Very,
it?
very high. Very, very high.
And you manage a lot of celebrities in the area and stuff. Are the disease?
Majority of them are not come on. It's a fad in Bollywood.
So just as we call you in a short, circle, celebrity doctor and stuff. Do they get different diseases? Do they get different treatment? Or do they get different attitude? I mean, is it difficult? I operate on a few and, I know there's a slight change in a ball game when we do that. But what do you feel about, different diseases, different treatments, different attitudes? What you have to be more careful or what happens?
So, diseases are the same.
Okay.
Attitude is very different.
Yes, you have to be on your toes.
Completely different.
Yes.
Okay. Approach has to also be completely different.
Approach has to be different.
Okay. It may not be what the textbook approach is.
Yes.
So, approach is different, attitude is different. The outcomes that they're looking also is very different.
Oh.
It's completely different. So, I would say it's a completely different ball game. So, that celebrity management is different and the routine patient management is different.
Adds a lot of pressure.
Lot of pressure.
A lot
Because
of time,
expectations are very high. And at times they're unrealistic.
That's but obviously they also need a doctor. They need good doctors, sensible. You have to be true to your profession and explain it. I think there's more of psychological treatment that goes into this.
And peer pressure is very high there.
Peer pressure is
very, very high. If X has done it,
Yeah,
Y
yeah.
and Z have to do it.
Okay, yes, I agree.
Come what may, has to be done.
So your family, I know Mrs. Bhargav is a dentist. She though is busy with Junior Bhargav.
Yes.
Most of
She
the-
stopped practicing.
family, his mother, father, they sort of.
So I lost my father in
Yeah,
2011 because of a sudden cardiac arrest. I was here only consulting, and
yeah,
he
yeah, I
came home
remember
and he
that.
just went down to untie his laces, and he was home.
So one thing I was not discussing, Abhishek, about this, about losing your near and dear ones as a doctor. Okay, there is always a regret. I had that regret when my father died and stuff. That we will not accept mortalities of a near and dear ones as easily as a normal. Tell me if I'm wrong. And I would feel, oh, I could have done something. I could have. Either a guilt is a little bit more, or it's something. I don't think doctors per se can take a near and dear ones with morbidity and diseases because we partly feel responsible. Do you think that happens?
I agree with you in some aspect, and I'll tell you why. I'll give you two examples. One was my father. As a physician and someone who used to handle a lot of critical care, still I do. I had seen various possibilities. He could be on a ventilator.
Yes,
Parents could be on the
exactly.
ventilator. Could be on dialysis. Could have had head injury. Multiple scenarios you keep thinking about,
Just
and how are you
on.
going to act in those
It's
scenarios?
difficult.
I never ever thought about a sudden cardiac death,
Yes.
and that hit me the most.
Yes. We just, just.
How could you never think about a sudden cardiac death?
Yeah, but that's why because it happens to everyone.
And why?
There's nothing you could have done.
Yeah, I know.
But our guilt, that is what I was
the guilt.
as a guilt that we didn't.
I feel if I would have known, I would have admitted him to the hospital.
I've seen that with most doctors.
I would have had the defib next to him, and had it happened, I would have shocked him and stuff.
So our guilt and our taking of near and dear one death are a little bit more problematic than a routine
It was
person.
very tough, and I was very angry with God. Okay, why did you give me an opportunity?
Yes, for all the knowledge and
What
you
is the
trained
point?
me. You trained me.
What
and
is the
now-
point? I couldn't save my father. You didn't give me an
I've had this
opportunity.
conversation with a lot of doctors, and they find this as it's just the way we are trained. It's not- What are your hobbies?
I just wanted to elaborate a little bit. 2 years back, my mother-in-law
I know.
was diagnosed with stage 4 cancer, CA colon, and she only complained of coughing.
They're in Delhi, and I remember this story, and
This
he told
was
me how
during COVID time,
Yeah.
and I said, "खांसी आ रही है, आप CT
CT
scan
करा
करो."
लो. Yeah.
Thinking कि कुछ होगा.
Ah.
And I got a shock of my life on that CT. That's the CT we
meds,
give
yeah.
second opinions on.
My God.
It had widespread metastasis everywhere.
So it's-
And we ran pillar to post after that, and we knew it was palliative care. It was not curative.
Curative.
And she was put on the first conventional line of chemotherapy.
A lot of pressures with that.
She did respond initially, and then it just went downhill. And we put in the second line, she did not tolerate, and she was suffering.
What are your hobbies to come out of all these stuff? I know you love traveling and you enjoy traveling, and I think we all realize that when you're traveling. And these are long drive. And I think you travel a lot with the family, you love driving.
Yeah.
So what do you like about this takes switching off the mobile is travel for you?
Yes,
What is
it's-
travel for you?
Travel is de-stressing.
Yes.
Travel is a break away from routine work.
Okay.
Travel is exploring. Travel is adventure.
So
Travel is
there was
relaxing.
a very wonderful statement I read in a book. So people who love traveling, is directly related to the bank accounts and pockets. So, wonderful statement. It's
It's an expensive hobby.
it's an expensive hobby. I mean, obviously, one can travel frugally, but with your schedules and stuff, you have to get down to travel. So traveling, you love to travel which part of the world?
So you see, I've traveled close to 50 countries,
Wow.
and Europe is the eternal
Your
favorite.
go-to. Okay.
Yeah, that is the eternal favorite. Where I've not traveled is South America, which is on the cards very soon.
The distance.
But it's the distance and-
24 hours of traveling.
No, it's more than that. There is no
Language barriers.
direct flight. There is one stop, and those flights are too long. And you have connections to Brazil, but you don't have connections anywhere else. You can't go to Argentina directly. You have to go either way to New York and then fly, or from Brazil to then fly. It's quite a
It's not
hassle.
easy. And
So
you travel with your family?
majority of the times.
Your kid is how old now?
He is 12 now.
And he enjoys,
he
he gets his time with his dad because you're very busy.
He's a pro now in travel.
Yes.
He can travel anywhere in the world alone.
Wow.
Absolutely alone, and he can be on his own without a problem. He's a complete pro.
Okay. So I think the reason why I feel like you're traveling is because you get this time with Misha and your kid and stuff. What would your advice be? Because obviously all of us get busy in that part of career and stuff. What would your advice be? Should we sort of just do what we are doing? Because ultimately this is the age where we make a reputation, treat more patients. We are younger and we have the energy to work harder, or we just sit down and say try to, because it's different in India and abroad. Well, the work-life balance over here
is missing.
We have to customize that, and I don't think most of us can have the luxury of the work. People keep on talking about work-life balance, work-life balance. In India, I don't think it's a luxury to have work-life balance. Would you agree? And what is the advice for this?
I completely agree. I mean, work-life balance is something that my family has been harping around.
Yes, all of us.
I listen
10,000 things.
to no ends.
I've spoken to Amita and she's been...
and I'm generally, they've given up. My wife has clearly told me that I'm your second wife. First wife is Sujay. And now my entire family and extended family know my first wife is Sujay.
Oh, nice.
So she's already taken the second status.
But what would you advise the youngster? What should they do? I mean, you really need to...
No, it is really tough.
It's a burn.
It is really tough, and you have an extensive burnout. Extensive burnout. So, you either cut down on work, and which is very difficult, because ultimately it's about availability, and patients who are sick, they have to be seen. In India, you can't tell them, sorry, it's a Saturday, it's a Sunday, I will not talk to you. You come on Monday. And unfortunately, our profession and our specialty, which is medicine, if you have high-grade fever, you will not wait for 3 days.
It
has to be done that day. If you have chest pain, you can't tell them that you take an appointment after 3 days or 4 days, and then you come down. See, a routine follow-up is one thing. But if you've got 500 sugars, you're not going to wait for 10 days that your appointment is available after 10 days.
And everybody wants Dr. Bhargav, so they can't say, you're seeing your assistant, and they still want you, and there's a lot of pressure.
So you have to see. So ultimately, there is a huge burnout. And if there is a huge burnout, the only way of, coming out of the burnout is
take off. But what would you advise? I mean, what are your sort of, obviously it's not natural, this kind of burnout. For future, for the younger doctors, how can they manage this? It has to be managed.
See, eventually I think build a team.
Build a team, that's important.
Eventually build a team. Have a team which can manage. You will still need to be present.
Yeah,
but at least the
a lot
team
of
will
things
be able
can
to
be
handle
looked after.
Multiple things. That's what I'm trying to build. And it's definitely helped me.
Yes, assistants, people working with you, they know what you want.
So currently I'm building on the assistants.
Okay.
And then I want to build laterally.
With nursing, paramedic support, or what?
Not necessarily. I'm talking about parallel in the sense have other consultants. Colleagues.
I know, because of late you have started working with Santosh and Zubin, and you all work as a team.
So
and that's good for an institute also.
6-8 years together. But that is on weekends and
when
each
on
of
calls, if you're busy.
But the next plan should be to have parallel consultants working under you as part of the team. So that even if you're not there,
somebody can look after. Patient care does not suffer.
Patient care does not suffer. And that will possibly also lighten up your pressures.
Your workload.
So you are not running in the middle of the night. You're not attending calls throughout the night. And I'm telling you, last 5 days I've not slept. If you see my call logs, the whole night calls have been on.
Yeah, looking still fresh and handsome, Abhishek.
That's for this. I took a facial for this.
You have a few assistants and you teach them. What is your sort of, how, for any sort of kind of knowledge and stuff, what's the your last sort of message to young physicians to share a little bit of your success, your learnings, your sort of some message you
I
like to
think
give?
hard work, knowledge, and dedication
Very important
is
in
absolutely
physician.
essential.
And I think that's true for any profession, but more so in our profession. Any advice to for people with lifestyle diseases, diabetes, some one or two sort of real honest tips as a doctor that you must tell them that this is what they must do to stay away from you.
They have to look at what they are eating.
Eating is the
That
main
is
thing.
very, very important. Ultimately, all of them are, everything arises from there.
Absolutely.
And they need to be physically active. I mean, I understand everyone cannot be exercising on the roads, but physical activity and
Diet.
diet, very, very important.
Great, Abhishek. I think I was feeling hungry, but now you told. I think it's a pleasure having you.
My
And
pleasure, yeah,
hope you all have liked this. And please, again, like, subscribe, forward. If you got any medical things, Dr. Bhargav is here. And it's very kind of you all to take out time and watch us. Thank you. Thank you, Matt.